Here I'm going to talk a little bit about an analysis of the 2014 Ebola outbreak investigation. The Ebola virus disease outbreak of 2014 was an international health emergency. With a fatality rate of nearly 50%, the rapid spread of this virus was extremely alarming. The transmission mode of this virus is from animals to people and can then be spread via human-to-human contact with broken skin or mucous membranes. Symptoms of the Ebola virus can become apparent anywhere from 2 to 21 days after initial conception of the virus, although people infected are not able to spread the virus until they begin showing symptoms. Some initial symptoms may include fever and fatigue, muscle pain, sore throat, and headache. These may progress further to include vomiting, diarrhea, rash, and impaired liver and kidney function. At its worst, a patient may experience both internal and external bleeding and potentially death. According to the CDC, the total number of cases of this virus during the 2014 outbreak was as high as 28,000, with over 11,000 deaths. On the right, you can see the number of Ebola cases from March to September of 2014, when the outbreak was at its worst. What can be difficult is counting cases that may have gone underreported, which is why these researchers included a corrected line factoring in underreporting. Below that figure, we see a timeline that begins previous to the 2014 outbreak, showing how many people die versus how many survive during an outbreak. This really shows how deadly and aggressive the Ebola virus is. The outbreak of 2014 initially began in Guinea, Sierra Leone, and Liberia of West Africa, but soon became a global problem. On the map, we see that Ebola has unfortunately been an issue for many parts of Africa, with outbreaks dating back to 1976. On the right is a geographical distribution of the cases seen in each of the 3 most severely impacted countries during the 2014 outbreak. When conducting an outbreak investigation, there are some important steps to take. Plan for the investigation. Be prepared in terms of personnel and resources. Verify the diagnosis. Confirm that the disease in question actually is what is plaguing the people. Identify the case numbers and understand the number of how many people may have been exposed. Choose a study design, whether that's a cohort study or a case control study. Collect risk information, sometimes better understood as the who, what, when, where information. Orient data in terms of time, place, and persons. Organized data can be extremely essential when time is of the essence. Perform lab analyses. Confirm or disprove cases. Conduct an environmental investigation where the exposure occurred. This will help answer the how and why questions. Implement control measures. Once a pattern has emerged about mode of transmission, when and who is getting infected, put in place control measures and try to contain the outbreak. Formulate and test a hypothesis. Collecting data on how the outbreak can be contained will be essential in stopping the spread. Conduct any other additional systematic studies. If the original study led to additional questions, go ahead and test them. And of course, always report the findings. This will help make the next steps clear in terms of containment and recovery. Steps that I, as a trained public health official, would have taken during this outbreak would have better reduced the spread of this virus through more significant containment efforts. Although the CDC notes that isolation facilities were set up to keep those displaying symptoms separate from the population, maps of the distributions were created to analyze the spread, and Ebola treatment beds were equipped in affected areas, it's clear that the efforts were too slow. Things that should have been done include an immediate shutdown of non-Ebola outbreak-related travel. An analysis of the Ebola virus outbreak showed that travel from one country to another, like in the case of Senegal to Nigeria, directly led to the spread of the virus. A secondary issue was that many people crossing borders did not have proper paperwork or documents that would indicate country visitation or citizenship, making it difficult to retrospectively analyze the spread of the virus. A faster mobilization of personnel and resources would have also helped. Although a vaccine was not available at the time of the 2014 outbreak, the medical professionals and equipment to contain the outbreak was. We just needed it there faster. And faster education to impacted areas about the signs, symptoms, and transmission would have helped significantly. Authors of one study found that population education about a disease was directly related to lowered case numbers in a secondary outbreak 3 years later. They concluded that a more educated population results in fewer cases of an infectious disease, and that this education is imperative to controlling future outbreaks. Although we can't change the past, I'm hopeful that these additional steps may be used in future outbreaks to better control the Ebola virus.